Hi, my name is Alessandro Vannucchi, and I am an associate professor of hematology at the University of Florence. Here I'd like to discuss with you the first results that we are obtaining from the JUMP study. The JUMP study is a single-arm, open-label phase 3b expanded access study. This is a very large study in terms of number of patients with myelofibrosis, both primary and myelofibrosis after polycythemia vera and essential thrombocythemia, who have been enrolled in this study, whose primary endpoint was to assess the safety and the tolerability of ruxolitinib based on the number and severity of the adverse events, as well as to collect additional endpoints to evaluate the efficacy of the drug in terms of spleen volume reduction, as well as patient-reported outcomes. So one characteristic of this study that we will touch upon in the next slide is that it included also a significant proportion of patients with intermediate 1 disease that were not included in the COMFORT 1 and COMFORT 2 registration trials. So the inclusion criteria for the JUMP study were to have myelofibrosis, primary or secondary myelofibrosis, to be high or intermediate to risk myelofibrosis, or to be intermediate 1 but with palpable spleen at least 5 centimeters from the left costal margin, and to not be eligible for other clinical trials. So ruxolitinib was administered at the usual dose based on platelet counts, and then patients have been followed for up to 24 months or until the drug have been commercially available, depending on the different countries. So the primary objective of the JUMP study was safety, and I have to say that there were no new signal in this patient population, in this large patient population, because more than 1,800 patients were included here as compared to the registration trials. In particular, I will focus on some safety signals. First of all, the rate of infections that was quite low and were mainly grade 1 or grade 2, as you can appreciate from the table. One particular attention has to be paid to the evidence that treatment with ruxolitinib may increase the occurrence of herpes zoster infection. And indeed here, registered about 5 to 6% events that were, however, mainly grade 1 or grade 2. So this data indeed confirm that you might expect an increased risk of herpes zoster reactivation, herpes zoster infection in patients receiving ruxolitinib. So in the whole population of patients, serious adverse events were reported for 35.5% of the patients, and the proportion in the DIPSS1 intermediate 1 risk cohort was slightly lower, 26.6%. Of course, mainly the most common adverse events were those represented by hematological toxicity. However, the adverse events led to discontinuation in only 17.4% of the patients in the overpopulation, and again, there was no different value in the intermediate 1 risk cohort, where it was actually 14.3%. There was evidence of activity, again, of the treatment with ruxolitinib in terms of spleen reduction. In the overall population, 70.5% of the patients had the spleen response, defined as a reduction of at least 50% from baseline in the length of palpable spleen from the left costal margin. A quite similar proportion of patients, 68.5%, obtained the spleen response in the intermediate 1 risk cohort. An additional endpoint of the study was to evaluate the improvement of symptoms. There were different questionnaires for the patient. The data here presented are with the FACT lymphoma total symptom score. And to make a long story very short, you can appreciate how about 40 to 46% of the patients had improvement in symptoms in the overall population, and this was similar in the intermediate 1 risk group. And it was also independent of the presence of palpable splenomegaly, because there were a subgroup of patients with myelofibrosis intermediate 2 and high risk with small spleen, no palpable spleen, and again, these patients benefited of treatment in terms of symptomatic improvement. Patients were followed for progression-free survival, leukemia-free survival, and overall survival, and the data here overall suggest that patients had the same improvement in terms of progression-free survival and overall survival, independent of the fact that they were in the intermediate 1 risk category or in the whole population of patients. And here you can appreciate how the estimates of survival probability were exactly the same in these two populations of patients. So to conclude, the data, this first set of data from the JUMP study that includes the largest cohort of patients with myelofibrosis that have received ruxolitinib to date, and also includes this specific subcategory of patients with intermediate 1 risk myelofibrosis, support that ruxolitinib is overall well tolerated, underlying the fact that the most common adverse events are represented by anemia and thrombocytopenia. And if we compare the intermediate 1 risk patients with the overall population of patients, these subjects seems to be able to better tolerate the treatment. And this, of course, might be a good support also as for studies that will include in the near future, such as a ReTHINK study, patients with early disease. The data from JUMP study also confirm that ruxolitinib is effective in reducing the size of the spleen and improving symptoms. And again, the data were confirmed also in the intermediate 1 risk patients. Finally, the improvement of symptoms was also seen in patients with no palpable spleen. And again, this is a new information as compared to the data that we have from the COMFORT studies, where only patients with splenomegaly were allowed to enter. Therefore, overall, this data from the large JUMP study reinforce the safety and efficacy profile of ruxolitinib in patients with myelofibrosis. Thank you for your attention.